Welcome 2024-2025 batch, the first batch of TSMC, right? Okay, so tell me what you have been doing right now, just before coming here. So that means that all circulations is here right now instead of here. So are you going to slip through my class then? Okay, so introducing me, I am Dr. Pomad Vara, your assistant professor, Department of Obstetrics and Gynecology, Tripura Santiniketan Medical College. And my allotted topic is language skill enhancement. So, the topic is language skill enhancement. See, you guys are lucky that just at the beginning of your course, this foundation course is there. In our classes, in our times, we used to directly, after a little bit of introduction with our peers, with our friends, with our would-be new friends, we used to directly embark upon this topic of human physiology, anatomy, and biochemistry. This foundation course, as per NMC guidelines, MCI guidelines, right now it is NMC, competency-based medical education aims to attain the academic quality and medical education as comparable to global standard. The goal is to achieve a competent you, the Indian medical graduate. The Indian medical graduate graduating from TSMC, Santiniketan Medical College. The Indian medical graduate endorsed with the qualities of commitment, excellent clinician, lifelong learner, leadership, communicator, and accountability to patients, community, and profession. As a thoughtful solution to provide technical, communication, and language skill, the curriculum implementation support program for CBME, competence-based medical education, has introduced this 1-month foundation course since 2019-20. So it is very recent. So as a part of it, the ITCOM module, I think you had been taught about the ITCOM module. It has been taken by Shukanto sir, I guess. Do you remember anything about ITCOM module? I saw it in the schedule. ITCOM, A-E-T-C-O-M. A for attitude, E-T for ethics, C-O-M for communication. See, these are totally unrelated to physiology, biochemistry, anatomy, my department, obs and gynae and all. So why we're learning it? See, medical science is something, it is unrelated to your other professions. It needs a human touch, right? It needs a human touch. So what are you? Just before 1 month, you are just a science student, right? And right now you are going to be, and suddenly you are in the fraternity of, you are in the medical fraternity. So this is a wide transition for you. You had been a science nerd, now you're going to be a medical nerd. Not, still your brain is developing, your personality is developing. What's your age? 17, 18? Huh? Personality develops throughout the lifelong, right? So this is it. Suddenly embarking upon these all 19 hectic subjects, a little bit introductory to, as a whole, the medical profession. I have seen some of the lectures taken by Dr. Anirban Datta of stress management, and any other interesting lectures you liked till now? And you have, I think, lectures on AI also, right? AI. See, imagine we have to taught AI to you, and computer skills. I guess you guys know computer skills more than us. because I do consider ourselves already a dinosaur. Huh? So yeah, we also need to be equipped in everything, not only this PTPT skills, like computer skills, AI and all, the use of AI in medical science, it's coming. AI is taking everywhere. It's taking up, no? It's taking up everything. Taking up everything all around the world. Robots are coming also. And so this is it. Many countries, like UK, Netherlands, they have already recognized the importance of mapping the cultural competency in medical curriculum to facilitate effective interaction with culturally diverse patients to downscale disparities in healthcare. That's the ultimate thing. See, within these 5 years, what are you going to do? You are going to, you're going to be a sponge, nothing else. Absorbing all the knowledges, 19 knowledges of 19 subjects, and then start practicing. Simultaneously, you'll be practicing, right? Practice the word associated with us, just how these practices have come. We gather knowledge and we practice the skills. As a student, you'll be starting practicing your knowledge, whatever you have gained from the lecture, directly in the hospitals, in the clinical classes, with the help of your seniors, with the help of your professors. And then after you have graduated, you will be practicing it alone, sitting in front of your patients. This is called practice. So this practice has become a derogatory word for, yeah, this doctor is practicing, he's busy building up his practice and all. So this is the real meaning of practice. We should always be practicing. We should never stop. What is practice? Practice makes you perfect. That's what we are. We doctors have to practice till the last day of our breath, right? For example, say from my point of view, this baby, let's change it. Message 1, you miss the party again, get a life. Message 2, thank you doctor, you saved my life. See, you have already entered in the medical life. Now your memes, jokes will be medical oriented, right? Okay, so what we saying? Yeah, practicing. Say for example, I have just learned something from the long back during my college days. Learned something from my lecture hall, GDM, gestational diabetes mellitus. Gestational diabetes mellitus means diabetes in pregnancy. I have learned it. Now I'm starting practicing it. On the very day when I go to the clinical classes, till now I'm practicing it. Yesterday also, when I saw a patient in my clinic, I have seen a patient pregnancy complicating with the diabetes. So that moment also I was practicing. Something new will come, right? Something new will come. Right now you are learning everything. You will have to know every subject, all of the 19 subjects. After that you will be specializing. You will be mastering in a particular subject, right? Not only mastering in a particular subject, you'll be mastering in particular topic. There was another funny, I think it's somewhere, no, I have not put that funny slide actually. You can't just say, sorry, this can't be cured. There was a joke, a patient coming to the doctor and sorry, it can't be cured. Why? Because I have not studied it. You can't say that, right? So not only you have to be master in one specialty, you have to be master in one particular topic also. In gynecology, how many topics are there? Many. And particular one topic you will be coming across every day, lots and lots of time. And every time you will be practicing it, you will be improving that particular topic. Again, I'm bringing diabetes mellitus in pregnancy. Many times you will see that. And every time you see a patient in diabetes mellitus in pregnancy, You have to increase your skill, your knowledge. See, master, just converge your knowledge to one point, mastering in one particular topic. Okay, I think I'm deviating from my subject. So, this foundation course. So why I'm here today? Instead of lecturing on my subject, I'm lecturing on language as a part of the foundation course. So why the foundation course? I've already said that I gathered it from the net actually. So main thing is that to make a competent you, not to be a Dr. Robo. You have to think humane. You have to give a human touch. 8-com module, you have to bring attitude in your subject, attitude in your profession, ethics, have to work with ethics, and communication is very important. Language skill, improvisation is also very important, especially in our subject, as compared to the other technical subjects on other graduation courses and all. How many of you are from here and outside? Everybody is here from Tripura? Tell me, who are from outside? You are from Assam and Assam, and you're from Arunachal Pradesh. Okay, you West Bengal, Bangla, and anybody? So what's the language diversities here in this lecture hall? Assamese, Bengali, Arunachali, and Kogboro. Yeah, Kogboro. Yeah, okay, and that's it. Okay, so there will be many diversified peoples will be joining you soon, I guess, right? Only 50 or 47 are you? How many? 47. 47, okay. So why language is important? Language is a way of expression, right? Is a way of sharing your feelings. And language is very important. See, you might be thinking that India is a wide, diversified cultural nation, right? And knowing, if anybody thinks knowing Hindi and English will do, I can survive in any parts of India. Is it possible? Yes, it is possible, but not for you. I've got many friends living in South India for many years and they are like bindas, okay? Not even picking up the language. Okay, fine. So, the population they are catering, the people they are catering, chal jata hai. So, somebody is in the banking sector, a local people coming there, and the Kannada people, what he will do? He will try to communicate with that Bengali people who doesn't know anything, Kannada language and all. How these things will going on? This will go on smooth. That fellow, local people, he just wants his work to be done, right? He will communicate in Hindi or English and back and forth. Hindi, English तो उनको भी आता है, ठीक है? हो गया काम, easy, ठीक है? Now you go to South India. You catch a auto wala, and the auto wala will be saying that with confidence, you go, yeah, Hindi English aata hai mere ko, I will manage that. Auto wala will be saying that Hindi illa, okay, and you start to converse in English. I don't know English. He'll be speaking that in English itself, right? For some reasons, you're rejected. Okay, you'll be having other customers will be there. Okay, fine. For some reasons, for some political reasons, you're finding it difficult. with your language, with that fellow, right? Say for example, Mumbai. Mumbai is a place of Hindi film industry. Okay, you work in a sabzi mandi in Mumbai. Just try to catch the word people are speaking all around you. Will you understand anything? Hindi movie बनता है यार वहाँ पर. नहीं, you won't understand anything at all. Marathi language is totally different. झोप आ लिया है. You understand anything I said? Yeah, she understood. So no way you will be correlating zop with nind. Huh? So that's it. A 65 years old lady, a 65 years old lady sitting in front of you, and she's saying to you, like, she's genuinely saying to you, she's not having this auto wala like attitude, she's genuinely sitting in front of you and crying. Ma moon na lende na தூங்கவே இல்ல, ரொம்ப தலை வலிக்குது, என்னமா பண்ண போறே? You understand anything? 3 रात से सोया ही नहीं, बहुत सिर में दर्द है, क्या करूं माँ बोलो. 65 years old lady. So that's the importance of you, that separates you from the bankers in Karnataka or Chennai or an IT people from there. You can sit with an interpreter out there, right? You can sit with an interpreter, but what will happen? Things will get lost in translation. Things will get lost in translation. See. So you try to speak a little bit in Tamil, okay? So you responded. You responded with a confusion, a hesitation of your own word, ma, enge. So what will be the response from that lady's side? She will totally lost interest in you. I literally came here to solve my problems. I'm not, what shall I do here? Okay, this will happen. Or she will forget looking at your confusions, what she has to say, right? And the moment you start speaking to her into her own vernacular language, and you see how the flow of clinical history you'll be having, right? So this is important. Language is important in our fraternity at least. And if you have lived somewhere for 3 years or 4 years and you have not bargained with a local vendor out there in aggressively in that local language, you have not lived in that place enough. Hana? Right? See, as I've said that many countries have already recognized, now you understand, recognizing the importance of mapping the cultural competency. This is called cultural competency that involves picking up the language to facilitate the effective interaction with culturally diverse patients to downscale disparity in the healthcare. Okay, just leave it here. हमारे दिए दो. So, now coming to, so since 2019 and 20, we had introduced this foundation course, right? The foreign countries have already long back understand the importance of it. But what we are doing, we're just nerdy things. We just keep on doing our work, right? Without giving thought. And we end up, you know, following our big brothers like UK, America, even the medicine we are practicing, is it Indian medicine? See, they have fight for their medicine so much. Now it has been established as a world recognized medicine and everybody is practicing that. We couldn't do anything without Ayurveda or Yunani. So that's it. We here mostly follow, say for example, I will tell about myself. We follow ACOG guidelines, FOXY, RCOG guidelines. RCOG is the Royal College of Obstetrics and Gynecology, UK. ACOG is American. RANSCOG is New Zealand and this Australian. But amalgamation of all the guidelines, we formulate our own guidelines and all. So that's what we're doing. So they have long back recognized out there. Now we are introducing it. It is very much useful in a place like India long before itself, right? If you talk about UK people speaks English, American people speaks English, even the Australian people speaks English. Australia is a continent, small continent. See, that's the thing. And here in India, in one country itself, there is so much diversified, multilingual peoples are there. We're not bothering. We just so attributing to the cultural diversity in India and multilingual background. It also happens that some students may find it difficult also to cope with the transition from their vernacular language to English as a medium of instruction. And the medical science exist in the realm of English. So I think everybody is proficient in English here, right? Confident in English. Super confident. Okay. But many medical students are there, those who have been accepted in the government medical colleges, you know, fighting NEET, PG and all, securing marks, coming from the background, coming from the rural background. What about them? So this is it. There is something, a terminology exists like limited language proficiency. Limited language proficiency. So how much you are proficient in that particular language? Proficiency in terms of speaking, writing and reading. So in India, most of the survey has been conducted that in most of the school, even if the medium of instruction is English, the teacher out there make the students understand by the vernacular language. They talk about the concepts. They explain the concepts in the vernacular language. Though best example is me. I belong to the Tripura board English medium school. We are only proficient in reading and writing. I can speak also. That's my extra credit. But the spoken language, spoken English was not that much encouraged. We used to talk our Khaisi, Bengali and all, and we just write in English. And even the teachers clear the concepts in the vernacular Bengali and all. We talk. We used to talk with our teachers with a colloquial language, not even a proper Bengali language, colloquial. So there is variations of languages in different parts, right? Even in the West Bengal, the Bengali will be so many types of Bengali out there, right? So that's the thing. So this is the limited language proficiency. So, and the cultural differences. How the cultural differences will be coming? Cultural differences like a South Indian guy going to the North India, there will be a big cultural shift for him, right? A Northeastern girl going to the western part of India will be a big cultural shift. Or anybody coming to the Northeastern part, it will be a big cultural shift. So these differences may reflect as ineffective communication, altered coping behavior and workplace maladaptation also. So it might influence their harmonization, conformation and knowledge acquisition in the same institution. I've already talked about this. already speaking on it. Limited language proficiency. Just now has talked. Oh, yeah. So there is an interesting study. This is after the foundation course has been introduced. The same year, 2019-20, Assam. 5 medical colleges took part in this survey. The college from Vishakhapatnam, the college from Burla, Orissa, Gondia Government Medical College, Maharashtra. Maharashtra से 2 college. Maharashtra से Gondia Medical College and Grants, Mumbai. Everybody has heard about Grants, Mumbai? No. Okay. And Jorhat Medical College, Assam. So they were asked to fill about the demographic details and all, like name, age, sex, and all, their address, and details of schooling, medium of learning and languages learned. And survey questionnaires included like perceived proficiency of English and the local language of the place in which the college is situated. It has been seen that 691 students participated. No, among them, some dropouts were there. Amongst them, proficiency in English is seen in 170 students. 170 students. 318 students in respective state language, and proficiency in both English and respective state languages 50. For English and state language proficiency, for English, highest proficiency is seen in the Grants, Mumbai. Mumbai ka Grants Medical College is in the proper Grants, is posh students. The undergrad student will be going with their shorts and all. That's Grants, Mumbai. Actually, I have lived in Mumbai for 2 years, I know. And lowest in Gondia Medical College, same. See, it's in both of the colleges in Maharashtra. English proficiency has decreased. Lowest is seen in Gondia Medical College, Maharashtra. Maharashtra में भी मुंबई है, Gondia Medical College में महाराष्ट्र में. And for state language proficiency, highest is seen in Jorhat, Assam. State language proficiency is seen lowest in Grants, Mumbai. Limited language proficiency for English. English is very important. Why? Because as I have already told, that realms of medical science exist in the language English. Out of that, students were proficient, they shows proficiency in English. Now also subdividing the level of proficiency, 75.4% of students among them maximum agreed that they have highest proficiency for reading. They can read nice, 84.26%, followed by writing, 82.15%, and least proficiency observed in spoken English. So though a student who could speak, who could read and write very nice English, understand, read the whole books, understand the concepts and all, but his spoken English proficiency is 43.95%. This is very recent, not long. Language, a little bit about language. Is a symbolic representation of our thought process. This is language. So if I ask you, if you're thinking something, in what language you're thinking? Your mother tongue only, right? Language competency exists in 4 domains: phonology, grammar, semantic, and pragmatic. Phonology means, say for example, a 3-year-old kid. Like you will be a 3-year-old kid when you'll be going to South India suddenly. 100% sure, because I have faced that. I was just an infant there in terms of language proficiency out there. And my experience was that all of the few students who are from the 0 language proficiency in that state language, literally 0 language proficiency, our main goal is that 6 mahina, we are going to drop medical science from our life. We are going to learn the language first, and then medical science baad mein aayega. So this is very important, how much important the language is. Phonology, yeah, for us, our language proficiency in that state starts with phonology. 3-year-old kid, okay, how they first start communicating with their mother or surroundings. 1 word, 2 word, yeah. If she wants water, pani, tanni, tanni is water in Tamil. Uh, then she, tanni, bas, water, water. That just saying the water will suffice for that kid, no? Solved, okay? The mother will be bringing water to her. That's the level of communication. That's the competency, language competency. The 3-year-old language competency is up to the level of phonology at that time. See, we also used to be like this. We used to say, we used to utter a word, the colleagues and the patient will understand. And then the grammar. After a few years, a few months, the baby will be saying, "Tanni kudinga, thoda pani do mere ko." Okay? You are bringing grammar here. Semantic. Semantic and pragmatic. This two is the highest level of language competency. Pragmatic, semantic, you can say just like the poets use the language, play with different meanings, play with the word, the meanings of the word, twisting their meanings and all. That's the form of language competency. I'm not explaining, I think you understand what I mean to say. Okay, let's explain. So, pragmatic. Am I not hungry? No, I am not hungry. What is I am not hungry? This is a negative sentence. I'm not hungry, you are not hungry. But the way I said, bringing my emotions and all, will be saying that she's damn hungry. That's a, that's the level of language competency. You have to learn a language. Even if you're learning new, you have to learn the language till that pragmatic level of competency. गाली देना मांगता है वो भी दिल से, and it should go directly there, it should reach there, right? I think I should not bore you anymore. Thank you for now.